The very first person was a relative of my wife. He had MS, and he was a very vital, healthy, vigorous sort of guy. And this just was taking him down rapidly to the point where he had ended up in a wheelchair. This guy was in a process of dying. But he had done a lot of research and said, I want my amalgams out. And I had never done that before. I'd never done it. So I researched along with him some protocols, some ways to do it in a way that didn't further contaminate him. And although what we did then was primitive compared to what we would do now, it was effective because here we are, that was 1985, this is 2010, you know, the guy's still alive, he's not in a wheelchair. Within 6 months after we took all that out, he got much, well, he was back at work, he was doing all the things he was doing prior to becoming that sick. Some people could say, well, that was spontaneous remission of the multiple sclerosis. Could have been. Could have been. But, you know, when the next person asked me to consider doing that, I wasn't quite so reluctant and got a similar sort of result, and a third and fourth and on down the line. It was, you know, it was very much a learning process, very much a matter of observation. There's a word that I like a great deal called obnosis. It's simply knowing what you observe. Some of what's called chronic fatigue or fibromyalgia, just a general malaise, constant flu-like conditions, headaches, you know, bowel problems, sometimes similar to irritable bowel, that sort of thing. Those would be really common things that we have seen over the years.